Welcome, I am Terry Tropin, and today I'll be discussing the ICD-10-PCS coding for coronary bypass procedures. Let me start with some information about myself. I have a master's in health information informatics. I have an RHIA, a CCSP, and I'm an HEMA approved ICD-10-CM-PCS trainer. I'm retired, but I was an adjunct professor for Montgomery College in Silver Spring, Tacoma Park, Maryland. I've also written some books. So these are the books I've written. I have a book on evaluation and management coding, a book on ICD-10-CM, ICD-10-PCS, and I have kind of a mini book that discusses the changes in the CM and PCS book for 2024. These books are available on Amazon and they are updated every year. Okay, so what are we going to talk about today? Well, this is an overview we're going to talk about. First of all, what is a bypass procedure? And then I'm going to talk about the components of table 021, which is the table we're going to talk about. Table 021 is medical and surgical, heart and great vessels, and then bypass procedures. We're going to take this table, we're going to divide it into two parts. Bypass of coronary arteries and then bypass of other parts of the heart, the atrium, the ventricle, the parts inside the heart or outside of the coronary arteries. First, let's look at what is a bypass. A bypass is defined in PCS as altering the route of passage of the contents of a tubular body part. In this case, the tubular body part is this, and the blood vessels here. So what we're seeing is, in this case, this body part value, the vessel, the blood vessel, is blocked by plaque, or it could be just narrowed. But the blood can't flow freely through this vessel. So what do? Well, we go around it like a detour. So we take a blood vessel from here, around it to here. So the blood flows around the blocked area and then can flow freely to nourish the heart. So that's what the bypass procedure does. Now, for other bypass procedures, such as gastric bypasses, the body part value in the PCS code indicates the body part value bypassed from the starting point, and the qualifier value indicates the bypassed value to the end point. Coronary artery bypass procedures are a little different. The guidelines read, coronary artery bypass procedures are coded differently than other bypass procedures as described in the previous guideline. Rather than identifying the body part value bypassed from, the body part value identifies the number of coronary arteries bypassed to, and the qualifier value specifies the vessel bypassed from. So it's opposite of the other one. Notice it talks about number of coronary arteries. We'll talk about that more later, but that's important. Another guideline says if multiple coronary arteries are bypassed, a separate procedure is coded for each coronary artery that uses a different device and/or qualifier. Also important. Bypass involving the heart is found in this table, 021. 0, medical and surgical. 2, heart and great vessels. 1, bypass. So you know what the heart is, but the great vessels are aorta, pulmonary trunk, pulmonary veins, superior vena cava, and inferior vena cava. So table 021 can be divided into two groups. If you look at the first 6 rows, those are coronary arteries. And for these, the body part values are the bypassed to, the qualifier values are the bypassed from, and these are number of coronary arteries. They're not specific arteries, they're numbers of coronary arteries. The remaining rows, which this part of the table will go into a different page, the remaining rows are more specific. They'll say atrium, ventricle, pulmonary trunk, superior vena cava, thoracic aorta. In these, the body part values are bypassed from, the qualifier values are bypassed to. So we're going to talk about these in two different groups, the first 6 rows and then the remaining rows. So let's start with those first 6 rows. The body part values are bypassed to. We have these values: 0, coronary artery, 1 artery, 1 coronary artery, 2 arteries, 2 coronary arteries, 3 arteries, 3 coronary arteries, 4 arteries. Now notice that these are numbers. They don't indicate specific arteries. The specific arteries are indicated in the picture here, but they don't talk about specific arteries in the body part values, which is very different. Usually the body part values are so specific, but in this case, they are not. Shoot. In most cases, more than 1 artery is bypassed. It may be a single artery, 2 arteries, 3 arteries, or 4 arteries. Now, there are only 3 possible approaches for these bypass procedures. 0 is open, 3 percutaneous, 4 percutaneous endoscopic. Now, here are the possible device values. 4 interluminal device drug-eluting, meaning that the device to keep the artery open, the blood vessel open, and it also gives off a drug over time. 8 zooplastic, meaning from an animal. 9 autologous venous, so it's venous tissue from the patient. Autologous arterial tissue from the patient. Interluminal device, it's a device to keep the vessel open but doesn't give off a drug. Synthetic, man-made, non-autologous tissue from someone other than the patient, and then no device. Now, it's a note: to be considered a device, it needs to be separated, not just moved over. So it needs to be taken on both ends, separated, and then placed. So here's an example. Internal mammary artery is loosened from one side and moved over, no device, because it still remains attached on one side. Another example is the saphenous vein graft is placed from the aorta to the coronary artery. That's a device. The saphenous vein, of course, is in the leg, so it has to be moved from both ends to be placed. So here are the qualifier values. Remember, these are bypassed from. This is where it starts. You have 3 coronary artery, 4 coronary vein, 8 internal mammary right, 9 internal mammary left, thoracic artery, abdominal artery, and aorta. So the thoracic arteries come off the thoracic aorta. And here are a list of those that come off that. The abdominal aorta, the abdominal arteries come off the abdominal aorta, and that's value F. So here are some examples to make this clear. So we know the first 3 digits are medical and surgical, heart grade vessels, bypass 0, 2, 1. So we have bypass from the aorta, so that'll be the qualifier value, right? Because that's the from. And the body part value is left circumflex and left anterior descending, so that's 1, and that's 2. Open approach, autologous arterial tissue. So that's 0, 2, 1. 2 coronary arteries, open, autologous, aorta. 02110 AW. Okay, so patient had a bypass, that's one example. Patient had bypass graft from the aorta, and that's W again, to right marginal artery, right coronary artery, So that's again is 2 arteries, open, autologous. So you see that even though it's 2 different arteries, it's the same code, 02110AW. So it doesn't matter that one is the left circumflex, left anterior descending, and this one is right marginal, left coronary artery. It's still the same code because it doesn't matter which arteries it is in the body part. It matters just how many. Okay, that's the point we're trying to make here. Which arteries doesn't matter. It's just how many arteries. So in the previous examples, the 2 cases were the same except for the specific coronary arteries involved. The devices and qualifiers were the same, but this is not always the case. So here's another example. Patient had bypass graft from the aorta to the right marginal artery and the right coronary artery using an open approach. However, the right marginal artery bypass used autologous arterial tissue. The right coronary artery used zooplastic tissue. Okay, so the device character is going to be different. So in this case, you code each differently. One artery for each. So 0, 2, 1 artery. So you have 0 here for this one. 1 artery, 1 artery. You have to do them separately. So you're only counting 1 artery. And then the device in this case is A for autologist and is 8 for zooplastic. So in this case, because there's a different value for any of the code, you have to do it separately. And you do each artery separately, each device value separately. If it's all the same except for the number of, in the previous one, it was just the number of arteries, so they were the same. In this case, you have different device values, so you have to do each artery separately. Okay, so we said there are 2 groups. The first 6 rows with the coronary arteries, body part values bypassed to, qualifier values bypassed from. So we've talked about that first group. So let's look at the second group. The remaining rows are much more specific. The body part values are atrium, ventricle, pulmonary trunk, superior vena cava, thoracic aorta. The body part values in this case are the opposite. This is why this is so confusing. Bypass from, qualifier values bypass to. Remember, the guideline just talked about the coronary arteries, which are in numbers of arteries. It didn't say anything about the rest of them when they were not numbers, when they were specific. So in this case, it's back to the old guidelines, the guidelines used for gastric and other bypasses. So body part values are bypassed from, qualifier values are bypassed to. This is really not clear in most of the textbooks and stuff that you have. I had to kind of research this because it wasn't clear. But the guidelines just say coronary arteries by number. So this is what we got. So the body part values are character 5 or bypassed from. And you have right atrium, right ventricle, left ventricle, pulmonary trunk, pulmonary artery right, pulmonary artery left, superior vena cava, thoracic artery descending, and thoracic artery ascending arch. So the approaches are open percutaneous, endoscopic, 0, 3, and 4. The device values are pretty much the same. Zooplastic tissue, autologous venous, autologous arterial, synthetic, non-autologous tissue substitute, and no device. The qualifier values are bypass to, meaning the end point. You have coronary circulation, atrium right, atrium left, internal mammary right, internal mammary left, animate artery, subclavian, thoracic artery, carotid, abdominal artery, axillary artery, brachial artery, pulmonary trunk, pulmonary artery right, pulmonary artery left, pulmonary vein, pulmonary right and left, pulmonary vein confluence, right extremity, and aorta. So here's the location of the innominate artery, value A. It's also called the brachiocephalic artery. In fact, when I Googled innominate artery, it always came up brachiocephalic artery. So this is what I got. Qualifier value U, pulmonary vein confluence, is a heart defect in which the pulmonary vein is abnormally connected. Okay, so here's an example. Bypass from the right ventricle to the pulmonary artery. The bypass is actually here in white. So this is to repair truncus arteriosus, a rare defect of the heart in which a common blood vessel comes out of the heart, and instead of the usual two vessels, the main pulmonary artery and the aorta. So I only got one coming out of the heart instead of two. So this is repair of that. So if this is open, we're using autologous venous tissue, you got 021K09Q. Okay, so this is fairly straightforward, particularly considering how the other part of the first half of this table was. Okay, so what else can be reported separately with these codes? Okay, so if the saphenous vein is obtained to use for a graft, you can report that separately. 06BP and then whatever approach is ZZ. The approach may be open, percutaneous, or percutaneous endoscopic. So that's 06BP and whatever. Extracorporeal circulation can also be reported separately. That's 5A1221Z. You cannot report separately hypothermia, lowering the temperature to depress the circulation, cardioplegia, intraoperative pacing, and insertion of a test tube. So the saphenous vein, as I think I mentioned earlier, is in the leg. So you take that all out and put it in to the heart and use that for the connection from to. And the leg. So that's completely taken out and put in. So it's a device. Cardiopulmonary bypass performed to take over the function of the heart and lungs during surgery. If it's performed with a CABG or a coronary artery bypass graft or other cardiac procedure, it can be coded separately. So if it's done at the same time as bypass, you can report it separately. So find bypass cardiopulmonary in the index. It's under performance, 5A1221Z. So this is confusing. Got to admit that, right? So turn to table 021 bypass in your book. Draw a line after row 6, the last row for coronary arteries by number. Note above this line, body part values are bypass to, qualifier values are bypass from. Below this line, body part values are bypass from, qualifier values are bypass to. So this is really important because they're just totally opposite each other. You can also write in there, code also harvesting of graft if done at the same time. Code also cardiopulmonary bypass if done at the same time. And you can write in the codes if you would like to make it easier for you. But writing the difference in the bypass to, bypass from is the most important note to make here. Okay, again, here are my books. These are available on Amazon. I will be updating them over the summer and the fall. If you have questions, comments, whatever, here's how to contact me. If you would like a copy of these slides, give me a thumbs up and send your email address to me at terry.tropin@gmail.com. I will send you a PDF of these slides. I'll be more than happy to. Thank you so much for listening. I hope this was helpful. Thank you.